Welcome to the Bearded PT. I am the Bearded PT. Got a little story for you about two groups of lumberjacks. These two groups of lumberjacks, very competitive and like to try to out-lumberjack each other. And they were of similar size and similar build. 3 in each group. We had an experienced guy who was brawny, and a newer guy who was a little scrawny, and a guy in betweeny. Now these 3 lumberjacks were out doing their thing, cutting down trees, and what do you know? All 6 of them injured their back. Now one group did what most of us tend to do. You go see your doctor. The doctor says, looks like you didn't damage anything particular, so here's some anti-inflammatories and a muscle relaxer. Give it about a couple weeks. Come back to see me if things aren't going so well. And then they went on to still have some back pain. They returned. Okay, let's do some x-rays. Didn't see anything on there. They're still having some back pain. They had an MRI. Okay, I'm not seeing anything on there. Let's send you to a specialist. Specialist goes in and we do maybe an injection. And then we're kind of going down this rabbit hole of more and more intervention and longer time. And these guys aren't working. They're still out of work several weeks after an injury. And they're spending money, healthcare dollars. Now, the second group, same injuries, the brawny, the scrawny, and the in-betweeny guy. And they were sent to, or decided to go, to see their physical therapist. After about a few days, their back pain really wasn't getting any better. So they decided, I better go check this out. And so what they did is they went to see their physical therapist directly. Now, in some states, they do allow for that. And the physical therapist takes a look at them. The brawny man had low back pain with a little bit of leg symptoms, but it didn't go past his knee. And it was within about 14 days. It was just a few days after the injury. And he had one segment in there that was a little bit stiff, and the physical therapist decided to do a manipulation and mobilize that area of the spine. The scrawny guy, the new guy, had some symptoms in the back, and when the physical therapist checked him out, he seemed to be a little bit unstable. He had a little catch when he tried to bend back up. He had to use his arms to crawl back up from bending forward. And so the physical therapist put him on a stabilization program, teaching him how to strengthen around that area. And then the in-betweeny guy had low back pain with leg symptoms going down his leg. Physical therapist checked him out and noticed that, when he bends one way, his symptoms get worse. Well, look at that. He bends the other way, and they seem to actually get better. So he put him on a program to centralize his symptoms through activity and movements in a specific direction. And when we looked at these two groups, the second group, who saw the physical therapist right away, they ended up going back to work sooner. Because they went to the physical therapist first, they spent on average about $4,000 less than their counterparts, their other group that they like to compete with. And they were back to work and out-competing their competitors. So, the moral of the story here is that going to see a physical therapist for low back pain is actually a very good idea. And the research backs us up on this. Now, the research that has been done has shown that the traditional approach of seeing the doctor and NSAIDs and anti-inflammatories, muscle relaxers, active rest or relative rest, taking time off, imaging, injections, so on and so forth, isn't terribly effective. Now, the misconception is that most back pain, 90% of back injuries and back pain will resolve on their own. And the reality is that it actually doesn't. About 79% of people who had back injury actually do not recover within 3 months. And that's only 75% of those same people recover after a whole year. Now, doctors are out there, they're very good. But some of the data that has been used, the research that has been used to support the idea of the traditional conservative approach was a study that was done looking at people with back pain coming to see the doctor. The doctor gave them the NSAIDs and muscle relaxer, and then the patient didn't return. And so the assumption was, they got better. But further studies followed these people a little bit later and found that no, they actually didn't get better. They just chose not to go back to the doctor because unfortunately it didn't work. Now again, that's not to say that doctors are out there doing the wrong thing. Doctors are really good. There's another approach, an active approach of going to see a physical therapist. So the research shows us that when you see a physical therapist for acute low back pain that is within 2 weeks of the original date of injury, you save on average $2,736. Now those aren't my numbers, that's research that has been done. That's a lot of money. Now the key thing here is how soon after your back injury did you actually see a physical therapist? Within 2 weeks. Now, let's add a little bit more here. Now you notice the 3 lumberjacks who got specific treatments from the physical therapist. The physical therapist didn't treat them all the same. The physical therapist saw 3 different types of back injuries and gave them 3 different types of treatment, fitting them into a different treatment classification. And by doing so, the physical therapist is able to save them on average another $1,300. That's $1,374, totaling about $4,110, more or less, on average total cost on health care, just because they decided to see a physical therapist right away for back pain. Now, back pain is the bread and butter for physical therapists. It is what we see. It is what we treat. And when we can take a quick and active approach to recovery, you will get back to work faster. You will be back to doing things you'd like to do and want to do and need to do. So, again, we've got good doctors out there. We also have some really good physical therapists out there that know what they're doing with back pain. So, if you happen to be out there lumberjacking away, or whatever it is your profession might be, and you have a back injury, don't wait. And if you do go see your doctor, which is great to see, ask your doctor, hey, can I go to a physical therapist? I heard that doing physical therapy sooner than later will actually get me better faster. It is okay to ask for that. So here we have it. Let's get better faster. Take an active approach. Take your own care into your own hands and make that decision for yourself. Saving $4,000 or not, up to you. Thank you for joining me today. Certainly, if you have any questions about this, ask me. I would gladly be able to give you the research that has been done on this. I am not making this stuff up. But again, thank you for joining me. Let's get moving, people. I am the Bearded PT.